Well, good morning, everyone, and hadn't done this in a while. Every day we rise is a great day to be alive. And welcome to Personal Coffee Talks Morning Show. And we're here with our co-hosts or hosts, Leah Drake Stitt and Thomas the Colonel Chapman. He's not in town, so you don't see his picture, but he's here. His voice is here. And we have a special guest with us this morning. But before we get there, Leah will introduce her. But before, Colonel, you want to do your disclaimer just in case we need it?
Okay, the views stated on the program or the guest and the host, and no one else, no third party. So hopefully we can stay out of Facebook jail or StreamYard jail or whoever's jail. Thank you.
Okay.
What? Is it my turn, James?
Yes, Leah.
Well, I'm always pleased when I have one of my children on. She is my daughter by another mother and father, but she's still my daughter. And none other than Miss Alina Saunders Jones. Alina is now an insurance agent for Commonwealth Employee Benefits. However, not only is she an insurance agent, she's an entrepreneur. She's creative. She has, what is your company called again, Lena?
The Everyday Christian Girl.
The Everyday Christian Girl, where she makes beautiful Christian cards, daily readings for you, as well as a number of other things. She's quite creative, but today we're not talking about her business. We'll have to bring her back on to talk about her business. Mm-hmm. But today we're going to talk to her about insurance, because we're at that time in that season when it's time for Medicare enrollment. And whenever you come to Medicare or Medicaid enrollment, you get all of these calls on the telephone, people offering all kinds of deals, telling you all kinds of things. But there's certain things that you need to know in order to make sure that you make the right decisions about what your needs are as far as Medicare is involved. And Lena, also, some people may be like me. Sometimes I say Medicare, sometimes I say Medicaid, sometimes I get them in the wrong order. So we will also share the difference between Medicare and Medicaid. So I am extremely pleased to welcome to Portsmouth Coffee Talk this morning, Miss Alina Saunders Jones. Welcome, Alina.
Thank you. Thank you. Good morning, everyone. Good morning.
Good morning.
And I can tell you, I love you all because I was just telling Mr. Overton, I do not typically get this early. So only for you all in Portsmouth Coffee Talk.
We appreciate that.
Of course.
We appreciate you.
So we're going to talk about Medicare in specific, but I will tell you happy 1 September. September is also Life Insurance Month. And I'll just give a plug. So the month of September is Life Insurance Month. That is extremely important because we get so many people who come to us after a death and they have a GoFundMe page and they don't realize just how affordable life insurance could be. So make sure you're getting that check this month in September for Life Insurance Month. Now, to go back to your original question for Medicaid and Medicare, the two difference, one, you can't have both. Medicaid is a subsidy of insurance that's offered through the state or localities. And they make the determinations whether you qualify for Medicaid based on factors as income and household size. When you're looking at Medicare, if you've worked those 40 quarters, 10 years, you automatically qualify for Medicare, and it's not based on income. It's based on age and or disability. Okay. The average age for those who are aging into Medicare is 65 years old. The process starts usually 3 to 6 months prior to their 65th birthday, but that is across the board. Localities don't matter. across the United States. Every state has a Medicare program. Okay. And if you're getting, I can tell you, if you are eligible for Medicare, you're probably inundated at this time with phone calls, 1-800 numbers. I would tell everyone some are legit, some are not so legit. Most of them are going to go to a call center. So you want to see if you can speak to someone local who knows your market, who knows your doctors, who knows what's going on in the Medicare industry in general before you give information out over the phone. Always be careful about giving out your information, your Medicare ID number, Social Security number, anything that can be identifiable, because Medicare fraud is a big thing in these upcoming years as well.
And Lena, what you're saying is so true, especially for some seniors. When they are called, they readily give out that social security number, thinking that the companies are legitimate.
Mm-hmm.
And it's important that you don't give any personal information out on the phone unless you know who those individuals are who are calling you.
Oh yeah, and scammers have gotten more clever. I mean, they will sound legitimate. Even the call ID may say Medicare, or the call ID may say something that looks legitimate. So you want to be careful. Medicare will never call and ask for someone's identifiable information, such as their social or their Medicare number. Typically, they will send that out to you in the form of a letter, just to verify who it's from. So be very leery of anyone asking you for your Medicare ID number.
And another point to make there, it might be a call center out of California, and they have figured out now how to have a 757 number.
Oh, yeah.
And you might see that, especially seniors or anybody might see that and say, okay, this is local, so I can trust that. It's those, because automatically you see those out of town certain numbers, and you say, okay, this, don't trust this. But they have figured out how to get 757 numbers, and you block that number, they call back again. So I think probably the best way is to, you know, get someone locally and have a sit down with them, face to face. I mean, the way it is now, because I've gotten those calls and everybody's gotten those calls, and I've challenged them, and you know, and by the time I challenge them, they either hang up or they can't beat what I already have.
Uh-huh.
So just be careful with that as well.
Oh, definitely. And Medicare is heavily regulated. But like you said, Mr. Overton, I don't care what you do, someone's going to find a way around the system. But it is heavily regulated on what we can say and what we cannot say. Everyone should be doing a Medicare review every year. Even if you've had the same company for 3, 4 years, if you like what you have, Medicare changes every year. The doctors may not be participating. If your medication changed over the course of a year, if you had a newly diagnosed condition over the course of that year, you want to make sure that you're doing an annual review. Medicare is one of those plans or products that's not a one size fit all. And we see that a lot. You'll go to church and you'll say, oh, well, I'm on Anthem program, I'm Humana, and that works for them, but may not be the right fit for you. So you want to speak with someone in general to talk about your specifics. What medications you on? What diagnosis have you had? Are you relatively healthy? Healthy? Do you travel? Are you a snowbird? Do you spend 6 months in Virginia and then 6 months visiting your grandkids in Florida? All of those are important factors when we decide to place you in an appropriate Medicare program.
So, Alina, if a person like I've been in the same program for a couple of years, so I can come and sit down and I can come and set an appointment with you. I can come and talk to you. You can review the program that I'm on, and then you can share with me what's the best program that would fit my needs at this particular time. It may not be the one that I've been on for the past 3 years. Am I correct?
Exactly. Exactly. Because things change. And I will tell you this. I know if you're receiving Medicare, you probably used to this big book you receive once a year that has all the Medicare changes. I will tell you most of my clients don't read the booklet. But some things are very important when it comes to even the formulas. They change every year what's going to be added, what's going to be removed or taken out. I will say one exciting news we have this year, and this is across Medicare, across the board. The Biden administration has done a great job with making sure they lower the cost of injectable insulin meds. And so if you're taking prescription oral medication for diabetes, that's not going to affect you at all right now. But if you're taking insulin, they put caps and ceilings on what you can be charged for those prescriptions. And so those are things that you want to keep abreast of. The pharmacy, I tell you, the prescription drug plans are probably the most volatile ones that change every year, that we have to make sure we are paying attention to our clients' needs. So just to give you an idea what it looks like, you have Medicare Part A. Medicare Part A is going to cover your hospitalization. That's typically free to everyone as long as you work United States, paid taxes, and paid into Medicare. You'll receive Medicare Part A is free. Many of our veterans also have Medicare Part A, and they may have VA insurance, but that's completely free. Medicare Part B, that's your durable meds. If you need equipment, that's your doctor's visits. That's going to be Part B. That is what you typically will pay a premium for, which is your Part B. Okay. The average premium this year across the board is $164.90 for 2023. Keep in mind it's a sliding scale. So those who make what they call higher income earners, their Part B premiums may be more expensive than the average set, which is $164.90. And then that's called original Medicare. So A and B is called original Medicare. If you have original Medicare, there are gaps. So what they've done is this amazing job, just to confuse you a little more, is they offer what they call Medigap plans or supplement plans. And you'll see those because they have an alphabet attached to it. You pay for those, and they may be a H or I or a G, but those cover the gaps that Medicare A and B don't cover, the co-insurance, the deductibles, things of those nature. You want to sit down because all of those pricing are based on your age that you get it, the county you live in, or the state that you're residing in. So those can change. And then they have Medicare Part D. That's your prescription coverage plan. Medicare Part D prescription coverage plan is purchased by a independent carrier. So that's going to be one of your Anthems or United Healthcare or Optima. They cover the prescription drug plans, and those vary. The payments can be $4 a month to $120 a month, depending on what the needs of the client are. Okay. Did I confuse you yet?
And a lot of people kind of move to United Healthcare because they're endorsed by AARP.
And that's more, and I will say this, they're a great product, but that's simply just an endorsement. They get to use the name AARP, but for the most part, if you're receiving a Medicare plan, for the most, it's going to have the same basis. The government has made sure that most of them have the same basic level. When you get into the differences is what we call Medicare C, and I'm sure you've heard on the radio, zero deductible plans.
Yeah.
That's your Medicare Advantage programs. Those change widely based on the carrier you're receiving it from. And they take the place of your A and your B and sometimes your D in one plan called a Medicare C, or you hear in the marketplace as a Medicare Advantage plan.
Girl. Boy, I
Let me
guess go ahead, James.
Yeah, if you're with a particular plan, and you hear about doctors having disagreements with some insurance companies, they'll prescribe something to their patient, and the company will block it because they say they feel like the patient doesn't need it. And I always thought that was weird. But is that something, if you're with a company and they keep blocking what you really need, is that something that you can change? Or is that, I know it's individual companies make those decisions. They have doctors there, but those doctors aren't actually seeing you. That's why I never understand how they can say, well, James doesn't need that for his heart, and my cardiologist is saying I do. So I guess we should look at that too. If your company keeps blocking you, that's an opportunity for you to say, I need to get out
Yeah,
of this.
definitely. Some companies are going to be easier to work with, but I will tell you this, everyone on Medicare has the right to appeal any decision. So and I will tell you, most people don't, because of course they give you a time frame. So if you have a prescription that was denied, a procedure that was denied, you and your doctor, and this is why it's so important to have a great relationship with a primary care doctor. because they will know your history. They could write. It's really based on the difference of what you as the consumer write, what your primary care doctor will provide documentation for as to why they recommend this prescription. To your point, you have someone who's sitting in the office and their sole responsibility is to keep costs low. That's what
Hmm.
they do. And so they're going to deny claims.
And many of them are not medical professionals.
That's correct. They do. They're reading off of, they're going through a script or what their company guidelines are when it comes to approving medications. And I can tell you, unfortunately, it's based on cost. And so something that has an absorbent amount of cost probably going to be denied. Although I've seen a great deal of appeals get approved just because the client went the extra mile and had documentation with the doctor as to say why this medication I'm prescribing. I've tried generics and they have what they call a step up plan. And so what Medicare providers want to see is that your doctor didn't go just to the most expensive plan, but maybe they've tried the generic. They've tried these other medications in this class and they did or did not work for you. So they want to prescribe this particular drug for you. That's usually when appeal gets approved. But they do have step programs. So most doctors, if they're in the Medicare space, they should know to step you into medications and document. Generic didn't work for me. This particular classification didn't work for me. And if they have that documentation, they do have a good job of getting appeals approved.
And then,
Yeah, and I know as a heart patient, the doctors really tried to use generic whenever they could, but there's certain medications that they will not give me generic, especially the antidepressant medication that keeps my body from attacking the new heart. So, and I hope that appeals process is something that can, I guess we have to have all our ducks in a row to make that process go quickly because, when you're talking about operation that's needed and you have to appeal, you know, uh, I don't know how long that process is, but I can imagine some insurance companies, depending on the company, that might want to, drag that out.
Oh yeah, well they do. I will tell you this. There's a whole consumer board for Medicare that support you as the consumers. And so they actually put in place there's a time frame. They can't have your appeal drawn out for 6, 7 months, a year. So there's
Okay.
a really short window that when you file an appeal, they have to make a response and a decision on your appeal and provide documentation as to why they chose to go the route decision they made. So I tell everyone, file an appeal, ask your primary care doctor if they're comfortable and how many appeals they file. You'd be surprised at how many doctors send in a one-word sentence like, this person needs this medication. Well, that's not sufficient for an appeal. They have to be a little more detailed as to why they prescribe that medication. Because keep in mind, and this is not your case, sir, but I'm sure, but keep in mind, pharmaceutical companies, they go directly to doctors to promote whatever is going on at that time. So doctors are also have an obligation and responsibility to make sure that they're looking out for their client, their patients, and not the pharmaceutical rep that comes in their office every week to show them
Indeed.
the latest and the newest
exactly.
FDA approved bells and whistle.
And Lena, what gets me sometimes is if a doctor prescribe a procedure that you need, and then the insurance company come back and say, "Well, no, you don't need an MRI. You need to just have an
Mhm.
X-ray." You take the X-ray, and then you have to come right back around and have the MRI anyway, because that's what the
Mhm.
doctor knew that you needed for that particular time. So that seems to
Yeah.
be a waste of money there. In the insurance line, I know I had a procedure that was necessary. They didn't want me to take the procedure the doctor wanted me to take. I took the less procedure and had to turn
Mhm.
around and have the procedure done anyway.
Yeah. And
So
unfortunately, that happens a lot. You mentioned the government and waste of money. So I'm not gonna I'm not gonna get on that tangent. But you know how the government could be when it comes to those processes. Most companies now have gone to a consumer, and if there's not a doctor, they may have nurses who work and looking at these appeals processes. So that's helped the process go smoother because someone who has a nursing or medical degree has some medical knowledge behind them. So that's
exactly.
helped some of the appeals process. And in anything, whether we're talking about Medicare or we're talking about the private health industry, we are our biggest advocates.
Hmm.
We are. And so, as a consumer, even though I'm not on Medicare, I've had to call the insurance company and say, my doctor says I need the procedure. If you're going to put it in writing saying you don't believe I need it, put it in writing, because that holds them liable if something should happen. So, we have to be our biggest advocates.
Mm.
And if you go to a doctor and you find that your pills are getting constantly rejected, you may want to ask your doctor for documentation. You may find that they're sending things that are not inadequate because they're leaving it to a medical assistant to send something so important off to your insurance company, and it's not providing enough detailed information. So there's so many different ways to look at the appeals process.
Okay.
Kind
So,
of.
actually, so what you're saying now, we're in the Medicare enrollment
Mhm.
season at this time.
Uh-huh.
And before you make that decision, no, that the season runs from when to when, Lena?
So it starts September 15th officially. I mean October 1st officially. But we go through October 1st until December 15th. That you can make any changes during that time frame. So you can go to a new carrier, you can switch plans, and those plans go in effect January the 1st of 2024. But I don't care how long you've been on Medicare, you need to have a Medicare review. Also, no matter if you go to me, which I would love for you to come to me, there is never a charge for a Medicare review. There's no insurance company or agents who should be charging you to review what you currently have to see if you're currently in the right plan.
And if you're not going to read that big booklet that they send to you,
Mm-hmm.
go to see Alina. Let Alina sit down with you and share with you.
Mm-hmm.
I know I need to, Alina, and I'm guilty. It's just that I've been with these folks for so long
Mm-hmm.
that I just continue to stay with them. So I definitely will be one who will come and sit down with you and help to make a wise decision as to what plan I need. And then I know others who get that phone call, and because they like the way the person sounds on the phone, they immediately sign up for that particular insurance, not knowing exactly what's being offered to them. So we must be wise consumers
Mm-hmm.
as well.
Yeah.
So if you are in that season where you need to make that decision as to the Medicare plan that would work best for you, it is imperative that you talk to an individual like Miss
Yes.
Alina Jones, who can walk you through, who can talk about the information that you're not going to read, uh,
Mm-hmm.
and just sit down with her and have her to share with you the plan that would work best for you. I'm going to see you next week, Alina.
Oh, definitely. And we're located right in Portsmouth, right off of Tyrenet Road. We're extremely accessible. We have an amazing team in our office. So definitely come and see us, call. I will give a shameless plug. You know, if you call our office, can I give the number now?
Give her the
Yeah,
number.
Okay. If you call us at 757-490-8016, and that's 757-490-8016. Just say you want to get your Medicare reviewed. We'll make sure someone gives, if I don't give you a call back personally, someone in our office will give you a call back. Which brings me to another important point, is that because I mentioned before that Medicare is so heavily regulated, as an agent who works under ethics and the requirement training we take every year, I cannot solicit someone else's Medicare business. So I can't call you. The consumer has to initiate the phone call, which is why you see so many 1-800 numbers on
Exactly.
TV. That call has to be initiated. And I have some well meaning clients who would say, "Oh, Lena, you have to contact my church member or my mom." I can't initiate any phone calls. The consumer has to call me and say, "I want some assistance or want a Medicare review."
Give me that number again, Lena, so I can put it
Sure.
into
It's
on Facebook.
757
Uh-huh.
490 8016, and mention you want a Medicare review.
490-8016
Hmm.
to get a Medicare review.
Yes.
kind of.
Someone asked for the number, so I already put it. I put it on Facebook so that they know where to call.
Definitely.
I'll back up a little bit. And you talked about the eligibility of getting Medicare, and usually we all think about Medicare getting it at 65 for Part A.
Hmm.
So also people need to know that yes, if you have end-stage renal failure or you need a
Hmm.
transplant or something like that, then you automatically qualify for Medicare. And or if you go out on disability after being on Social Security disability after 2 years, they also enroll you into Medicare. Am I correct?
You're absolutely correct. So it's not something just for 65 and over. It's
Yes.
65 or a qualified disability.
Hmm.
And those do change. I know you mentioned end-stage renal failure. That's one that's almost an automatic, but there are other disabilities that may qualify you for Medicare or to participate in Medicare. So yes, you want to make sure that, and most doctors will advise you if you have one of those chronic illnesses, or you, as you stated, you are on Medicare, or if you're on disability, if you're receiving SSI disability, they will automatically send you documentation when you qualify, because it is a time frame. But yes, then to your point, there are definitely other factors outside of age that people will qualify for Medicare.
Yeah.
And then,
Great.
and how long is the process for those who may be in a disability state and they need to get how long is the process usually for them receiving the Medicare benefits?
Well, the application process is actually very reviewed very quickly. If it's a one page, they go to the Medicare.gov and they set up an account through the SSI or Social Security Administration. Once you answer a few qualifying questions, the system will automatically tell you if you qualified or didn't qualify. So it's a very easy process. You'll have response within usually 2 to 3 days. You'll have a response for your Medicare application. So it's not a lengthy process at all. If you are denied for Medicare, maybe one of the questions wasn't answered correctly, they will tell you why and also give you opportunity to appeal that decision as well.
Wonderful.
Let
Wonderful.
me ask about the companies that probably offer the health insurance. And, usually it's pretty good, but you have to be aware, once you leave that company or something, because this kind of happened to me. I was with the company, and when I got sick, I'm thinking I'll still be covered. When it came down to I couldn't work for them anymore, that insurance cut off so quick. And then I was out there for a little while without insurance, needing heart procedures. And luckily, and didn't realize that it had cut off that quick. But anyway, luckily, for that little short period, or I would have had to pay, an enormous amount a month, to keep that insurance going. And luckily, because of my condition, for a little while, I qualified for disability. So I could get that until, I was at a point where I didn't need the disability anymore. But, people should be aware if they're working for those companies, they need to prepare for the time when they might not be there anymore. What are they going to do once they're not employed anymore? And some companies will carry on, but you have to know what the company's policies are as far as the insurance that they offer you.
And that's a great point too, because I will say this: if you're still working and you have a qualified employer plan, you are not required to take Medicare, and there's no penalty. Because I have some people who are already paying for them. They decided they don't want to retire. They're currently working. If you're covered under the employer's plan, if you do not elect Part B or Part C or supplement plan, you will not be liable for any type of they call it, if you have a penalty for late enrollments. If you have a qualified plan, you have 10 months once you've left your employer in order to sign up for a Medicare plan and have an open enrollment period as if you just turned 65 or became eligible through a disability. Okay. So it's not one of those things that you have to have if you're working. Now, if you're working, and let's say today is September the 11th, and you retired this month and your benefits end at the end of the month, they will do something where they allow you to go back a 30-day period or start effective October the 1st. It's really up to time. So you want to make sure you get your application in a set amount of time. They also have what many people will call the Obama plan that we know as the ACA plan. That's the individual market that individual can go to get insurance, whether they need it for a short period of time because they've had a qualifying issue like the loss of a job, or they're sick, they became disabled, and they've lost whatever coverage they previously had. There are ways around so you're not will be without insurance. Okay. just to mention this, I know we'll come back, but Virginia has a new plan. Before, everyone would go to healthcare.gov to get benefits, where Virginia has gotten to have their own market. So Virginia residents would be going through the Virginia Exchange and not the National Exchange, effective this enrollment season for January 1st. That's new and just came out.
Okay, that's good.
Okay, Lena, for clarification. Okay. Like I'm still working, right? And enrollment period is coming up. Should I make a decision as to whether to go on the company's insurance plan as opposed to take what would be the, I mean, I'm going to come talk to you, but just in the event individuals out there now, they're still working, should they take that portion of Medicare we have to pay, or should they go with the insurance, with the company's insurance plan? What's the best avenue?
What we typically would do is look at the insurance plan that your company offers compared to a Medicare plan you enroll in and look at costs.
Okay.
Surely, if you have a great qualified Medicare plan and your employer is paying a portion, because most cases your employer is paying a portion of your premiums monthly. So that could be attractive people to stay on to their employer's plan. So we look at what you currently have down to your deductibles, your co-insurance, your copay, and determine if going into the Medicare system what makes sense for you, more so through your financial reasons and or any type of medical conditions you currently have. So it's very individualized. So I don't want to say if you're an employee plan, you should stay, because it's really going to depend on how robust your employer's plan is.
And that's
some
all
employers have a high deductible plan. Yep.
All the more reasons why you really need to sit down and talk to someone if you do not know. Once again, let me say, Alina Saunders Jones is with Commonwealth Employee Benefits, which is right on Tire Neck Road. I get Tire Neck and all those mixed up. Tire Neck Road, right on Tire Neck Road. And the number is 757-490-8016. It is incumbent upon you as a wise person getting into this insurance business to sit down and talk to someone who truly understands the benefits so they can walk you through and so that you can have the best plan for you. I think it's a plug in for you.
And let me add this too about the company plans, employee plans. You know, if you have that, get someone that's an expert like Alina. You know, don't let someone from customer service
Thank you.
explain the plan to you, which was my case, and was really misinformed. But I trusted them, but I didn't think, you know, to know, does this person really know? And they didn't. And really in between the mix, that's what happened. I really got messed up, not really knowing exactly what the company would do. And it's a good thing I went through that route, because the company wouldn't have handled the kind of operation. You know, they definitely wouldn't have handled a transplant. But later on, what I end up with, Medicare, you know, of course, is going to deal with that. So just make sure you are well aware of what your company is offering you, and don't have someone from the company that works for that particular company that's not an expert explain to you what you have. You know, just be aware of that. Know what you have.
And don't go to your neighbor and your family members thinking they can explain to you what's the best plan. They're not experts, so they're not the ones that you need to talk to. You need to find someone who really understands Medicare and understands your insurance needs.
And it's really complicated, you know.
Yes, it is very complicated.
It can be. And to Mr. Overton's point too, I don't work for one specific carrier. So I have to make sure whatever I'm doing is in the best interest of my clients. And so we are contracted with all the major carriers. So I don't recommend one over the other unless it's beneficial for my clients who are in front of me.
Yeah. And that's good. Just like you said, Leah, you have family members and friends saying, oh, I have this and I get all this, but that doesn't necessarily mean it's going to work with your situation. So going to someone, a professional like Alina, you know, can really look over your plan and tell you which way to go. Can I ask one more question? This is concerning mental health and how people can be covered for that. A lot of people in the African American community do not seek that kind of counseling they might need because of a lot of policies don't cover that. If you go to see a clinician, it's going to cost you make sometime out of pocket, or they don't pay as much as they would for something else. How is that going in the insurance industry? Is it getting better as far as covering mental health issues?
I would say it's getting we're not there yet, but it's definitely getting much better. And when I say not there, I will say that we do have to thank President Obama when he came up with the ACA requirements. And
Hmm.
so with the ACA requirements, there are certain benefits that every insurance company has to offer at a minimum baseline. And behavior science or behavior mental health is one of those caveats. Now, with that being said, it's not regulated on what those out of pocket expenses will be. And so there's some carriers that charge a straight copay, and it may be $20 a visit or $45 a visit. Some will charge more exorbitant costs, but it is a requirement in every affordable healthcare that there is a behavior health or mental health component to that. And so you kind of fall in a caveat if we have someone who has a higher deductible plan because it's more affordable for their family. Where if you have a $5,000 deductible, you don't want to pay that prior to going to see a mental health professional. But with that being said, there's so many things out here to make it more accessible. This is not a plug. I don't get paid for this, but there's a company called BetterHelp.com, and they are a coalition of mental health professionals. It's nationwide. You go in, you put an application in and say, I want to speak with someone. This is not attached to your insurance, so your deductibles and things don't come into the play. They charge a flat fee every month, and you get to have visits virtually, because most of them will be virtual, with a licensed mental health professional in your area. I know that's one of the most reputable ones, but it's called BetterHelp.com, and it's for the initiative, as what you just mentioned, of making mental health affordable and accessible to everyone. In our community, we're known to go to church, you'll see Jesus first, but I believe in Jesus in therapy. Okay.
Indeed.
So you do have those, and then a lot of people don't realize that most large employers, and when I say large, I'm not speaking of these major companies, but if you have a company that has 10 employees or more, they have what they call employee assistance programs or EAP plans. Most group plans have an EAP in place for their subscribers that provide some level of mental health services for their employees and their family members who are in their household, and they normally give you so many visits per incident. So if I'm going through life and life starts happening, through my insurance, I can receive four mental health visits. If something happens next month and I get another stress, that's another incident. You get four additional visits. So most people don't realize that if they are under a group plan, they do have an EAP plan usually attached to them.
And I have to mention this, and Colonel, I think you'll like this, and you can comment on this. I think you mentioned two different presidents that, while they were in office, did some things that helped the consumers of health insurance. And
Mhm.
somebody that was in between those two presidents didn't do anything like that. But anyway, as a matter of fact, tried to take it back. So
Mhm.
saying that, it's important who we put in office, even as when it comes down to insurance, and how we are protected as far as that is concerned. So I had to make that point because that's very important. Because you mentioned those two guys that did something that helps, a lot of people,
Oh yeah,
Lena,
a
You
lot of
know what?
consumers.
we just
You are
got a
so
question
correct.
about the insurance. She said it's bettermentalhealth.com.
BetterHelp.
Betterhelp. Betterhealth.com.
Uh-huh. That's
Oh,
correct.
okay. Just betterhealth.com.
Help. HELP.
Oh, BetterHelp. Thank you.
Mhm.
BetterHelp.com.
Go ahead, Colonel.
Yeah. So you're correct about people in power that wants to that don't want people to have health care. So I will tell you that one, it's Mr. Trump, who was in office, tried to gut Medicare, and actually the entire GOP, that is part of their platform, is to privatize Medicare. And when that happens, you'll see your costs and quality go down, 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 down the toilet if that happens. So far, the Democrats have been able to, shine them off, keep them off the ridge from that. So I'll say that one piece there. So, but I will circle back around too. You talked about Plan B, and if not taking Plan B, uh, at 65 because they have an employer-based program. But when I quit, so if I don't take Plan B, which is, or when I don't take it when I sign up for Plan A at 65, if I take it later on, there'll be a penalty, and I have a lifetime penalty for Plan B. Am I correct?
So you don't have a penalty if you have a qualifying healthcare plan in
Yes.
place. So if you have an employer plan and you decide not to enroll in Part B, and let's say you want to work another 2 years, there is no penalty as long as you're on the employer plan. The penalty comes in place is when you're eligible and you just decide you don't want to pay Part B because you're relatively healthy. I only go to the doctor once a year for a physical, so I want to pay the 164.90 or whatever the premiums are a month. So I'm going to just ride it out and wait for a few years. And then health conditions change and you decide to get into Plan B, then you have a lifetime penalty that's associated with that, but not if you're under a qualified healthcare plan and decide to defer your Part B enrollments. And so when you decide to do Part B, it will actually ask you on your application, are you covered or have you been covered within a certain time frame? And that kind of alerts them whether or not you have a penalty involved. The same does apply to prescription drugs. So there's a penalty for not enrolling if you're not eligible for a Part B plan and a Part D plan. And those are lifetime penalties.
And Lena, Dr. Duncan wants to know, what is the value of a secondary insurance, and is Medicare useful as a secondary insurance?
I will have to say, great question. I wish I could give you a concrete answer, but it is really dependent upon what your health conditions are, whether or not you need a Medicare as a secondary payer. Depending on the size of your company will determine if Medicare is the primary payer or the secondary payer. So a lot of times you have issues when it comes to paying those bills. Medicare is saying we're second. Your group health plan is saying no, 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 we're second. Medicare is first. So that there are some caveats as to who qualifies to be in first position to pay the majority of those bills based on the size of the company that you're working for. So there could be some benefits depending on your current plan with your healthcare provider. There are also some cases where the employer has a good plan. There's no need for a supplemental plan. You're paying for something you may never benefit from every month just because you have a robust employer plan. So it really depends on what. I wish I could give you a yes or no answer, but it really depends on what your current coverage looks like, whether or not you need a supplemental plan as a Medicare or the employer plan.
I'll help
Okay.
you out on that one though. But Medicare only covers 80%. Am I correct?
Original Medicare. So I
Original
think this
Medicare.
person referring to if they
Yes.
have other insurance like through their job and they want to
Yes.
also add Medicare to their
Yes.
plan. So yes, typically if you have original Medicare, Medicare Part B only covers 80%, but that's why people get
Yes.
supplemental plans. Or
Yes.
they will have a job who's going to be either the first payer or the secondary payer, and then Medicare becomes first or second, depending on how many employers your company has, determines who pays first.
Yeah. The majority of the time, in my experience, is that Medicare becomes the primary once you hit 65, and the companies try to take up what's left over from that. And then so in the caller's question would be, I would think that Medicare is going to be their primary, and her, because she is still working and has private insurance, they're going to pick up what's left over from Medicare. And that's how that's going to be. So that brings her to the question is, when you leave the workforce, do you keep, should you keep your like Blue Cross Blue Shield or whatever plan you have in retirement and pay that fee, whatever. If you have a work for the state or federal government, do you keep the your civilian insurance?
Yeah, and again, that kind of depends on what you have. So, for example, I have people who have federal employees, and their insurance provided for their retirement is well adequate to Medicare. So they may not need the Medicare plan as a supplement payer because of their retiree plan. It honestly is going to depend on how robust that plan is set up. And back to the original question, as far as payer for first or second payer, and only because we've had this company office, it depends on the size of the employer, whether or not they're considered primary or secondary and their level of coverage. So for someone who's in a smaller company, has less than, probably 50 to 100 employees, Medicare is going to be primary. But if you're working for a larger company who has global and statewide offices, they may be considered the primary payer and not Medicare.
Okay, now Lena, TRICARE. Antoinette Chapman would like to know, can you defer Part B and D with TRICARE?
You can. So TRICARE is considered a qualifying health and qualified plan, so you don't have to go into the Medicare space. Although I will tell you, you will see effective when they start running commercials. They have done a good job working with the VA system, and so you will see they have it where you can actually be a veteran and participate in some of these standard Medicare programs as a veteran at very little or no cost. What they're looking at is transferring risk, if that makes sense. Because usually with TRICARE or TRICARE for Life, they will allow you now to go into the marketplace for Medicare if you choose to do so.
Thank you. Antoinette, you got your answer. From Miss Alina Saunders Jones from Commonwealth Employee Benefits.
Let me also get this in before we about 5 minutes, 6 minutes. You are a twin, right?
I am.
Yeah.
Mm-hmm.
And the mother of twins, right?
That's right. I do
So,
everything double.
And her husband was a twin.
wow. Well, that explains it. That explains it.
Yeah.
Because sometimes it sort of skips a generation and then it happens. But a twin,
Oh,
and
they
then you
told
have
yeah,
twins.
we thought it skipped generation. Did not happen, you know.
Yeah.
Uh,
But
can,
anyway, and both of those girls are at Virginia State at the moment.
They're at VCU.
I mean, VCU. Oh,
Mm-hmm.
okay.
Uh-huh.
I'm sorry.
Yep.
I
So
tried
they're at
tried to give
VCU.
them Virginia State, but that's
Well,
just
they
as
look, they
good.
spend so much time. I probably owe Virginia State some money. They spend more time at Virginia State campus.
Well,
So
that's where
they've
it's
had the
happening.
best world. Oh yeah. Oh, they
Yeah,
love it.
get a little bit
Yeah,
of that HBCU experience, and
that's right.
everybody needs that. But anyway, I just
That's
wanted to
right.
make that point, and you also a member of DST.
Yes. Oh no. Not, am I a member of DST? Nope. That's my twin sister and my mom.
Oh, and your mom. Okay, all right. So they're waiting
Uh-huh.
on you.
I know. I know.
Okay, I just want to get that little bit of personal thing in there. But
yeah. Can, can I clarify an answer for you?
Uh-huh.
Antoinette asked the question about delaying Medicare because you have TRICARE. TRICARE tells you at 65 you must sign up for Medicare, and so and
You
TRICARE
said who
becomes a
told her that now?
secondary. Say what?
You said TRICARE makes
Says
them come
you.
off of TRICARE?
Yeah, you have to. No, you're not coming off of TRICARE, but you
Oh
have to
yeah. Mhm.
sign up for Medicare because that will become at 65 your primary, and TRICARE is or TRICARE for life is your secondary insurance.
Okay. I do know you have to sign up for Part A, um, or accept Part A when you have TRICARE for life. I was not aware of them becoming. We have a couple of clients who don't even have Medicare because they have the TRICARE, the VA benefits. But that's something we can definitely look at. I'm not sure if that's changed for 2023 or 2024. So I don't want to speak on that. But I wasn't aware that you had to change from TRICARE.
Yes, because one, it's even stated on your ID card when turning 65. You have to go in there and make sure that you have the Medicare number. And they stamp it on your card to update the system. And so they're making sure that you are signed up at 65.
Yes, you do have to sign up for Medicare. Remember, Medicare Part A has no premiums attached to it.
Right.
So you do have to sign up for Medicare. Medicare Part A does not have any premiums attached to it. So there's no, uh, what I'm looking for. It wouldn't be a situation where the veteran be in a worse situation financially because there's no premium required for Part A. So the person would want to go into the Social Security Administration, set up an account, and sign up for Medicare, if that makes
Yes.
sense.
But that does
Yes.
not take away. But she's asking about deferring Part B and D. If she
Because
signs up
she's
for
currently
Medicare, that's
on
Part A.
TRICARE.
But she is TRICARE, signing up for Medicare, which is
Mhm.
Part A. But can she defer B and D?
I
What,
would advise you
Leah?
can, but I would verify if she has TRICARE for life. If she's required to sign up for Medicare, and it's not part B or D. She either will sign up for, it could be a C plan, but if she wants to accept all of original Medicare plus her TRICARE or defer. So
Well,
have her call the office. We'll actually check with Medicare to see if she has TRICARE for life, if she's required to sign up for original Medicare in its entirety.
yes, she's required that. And when you talked about Part D, she does not have to take Part D because TRICARE is qualified to have a drug plan by itself. So you do not have to sign up for Part D because D would be an overkill and a waste of money.
Okay.
Mhm.
All right. Just for clarification's sake.
Yep. So yeah.
Mhm.
Uh-huh. Well,
Most of
Alina, I knew that this was definitely something that we needed to discuss on Portsmouth Coffee Talk, especially during this enrollment season. And once again, don't go to your neighbor, don't go to your friend
That's
because
right.
because she has this insurance and she's getting groceries, $100 worth of groceries, or because you go into this plan because they give me rides to
Mhm.
the doctor's office. Get what's best for you, what your
Mhm.
needs are, not based upon what your neighbors have or what your friends have, or even what your spouse has. Get
That's
what's
right.
best for you. So it's important that you sit down with a qualified, certified agent who can look at what your needs are and share with you what the best plan is for you. Once
Mhm.
again, Alina Saunders Jones is with Commonwealth Employee Benefits. And once again, that number is 757. I'm getting to it.
Mhm.
757. Help me, Lena.
490-8016.
490-8016.
Mhm.
Call and find out what is the best plan for
For
you.
you.
And during this enrollment season, make sure you make
Definitely.
a good decision.
Yes, and definitely talk to someone because, as you can tell, all the conversation we had this morning, it can get complicated, but it doesn't have to be as complicated as it is. But some people can make it that way. Leah mentioned about changing just because you get a ride to your doctor or you get certain
Mhm.
groceries. That's good, but when it comes down, you have that insurance to come down. You need a open heart surgery or some kind of major surgery. You might find out because you get all those other annuities, you don't get what you really need. So just pay attention, be aware of what you're getting and what you need for your particular circumstance. Talk to a professional. And I'm talking from experience. I listened to a lot of people telling me, "Whoa, I did this and it was good," and I kind of listened and I kick myself every day for listening to some of those things and not talking to a professional first. But I won't do it again.
That's right.
But anyway, but life is the best teacher.
It is the
That's
best
right.
teacher.
And thank you for having me on this morning. I've enjoyed the conversation, and thank you for what you do for keeping our community informed on Portsmouth Coffee Talk. Thank you so much.
We
Well, thank you,
appreciate you, and please come back and talk about your other business
Oh,
separately.
definitely.
we'll schedule that.
Yeah, we
All
we
right.
definitely need to have her back to talk about her creative business here. So it is really rewarding, and so we need to have her to come back and talk about that as well. So
Well,
Lena, I
in the,
thank you.
in the, in the interest of her not being an early riser, we'll probably do it in the afternoon show.
And and James, and it may be beneficial to us to come back in the afternoon and talk about Medicare enrollment as well. I know they can go to the YouTube channel to see it, but sometimes we just got to keep the information before the people. So we may need to have Lena back on a Thursday afternoon, a 7 o'clock show, so that others who may miss today and may not go back to YouTube, we ask you to go to YouTube and subscribe, but if they don't go back to YouTube and subscribe, that we will have the opportunity to share this information again with the public because it's crucial, and,
Yeah,
and it's
indeed.
and it's the enrollment period, so it's crucial that we do this.
Yeah, just like watching a movie over and over again, it's always something you miss. So
That's
Exactly,
right.
coming back, it's always something that we can add to whatever we talked about today. So we appreciate it. Any last comments from the host?
Colonel.
Yeah, yeah, great discussion, and I think we need to have the same discussion in depth because I have questions on you mentioned clients that have the VA insurance only, and so there is risk for you to do that, and it does. I mean, great financial risk and healthcare risk for having the VA is your only mode of
Oh yeah.
way of seeking health care. And
Mhm.
so that all this I could talk forever about this insurance thing. That's what I
Yeah.
did. I did my master's in healthcare administration.
Mm.
Oh
So
wow.
yeah. So we can talk.
But Colonel,
Yeah.
that's even more that seconds our opinion that we need to have Lena back on that 7 o'clock show, that Thursday evening show, to further discuss. And you can ask all the questions you want to ask, Colonel.
Would
Yes.
love to.
Yes.
But Lena, once again, I want to thank you. I know it was the last minute I asked you, and you
Oh,
said yes, you would do it. And I'm so grateful that you did because you have opened my eyes as well. And as well as I'm sure you've opened the eyes of those who are online and they're watching the show and realizing that we have to take charge of our health and we have to
yes.
get what's best for us. So I thank you so very much. And I look forward to sitting down with you, maybe even this week, before I make
I'll
my
be
trip
there for you.
on October
That's
1st.
right.
Okay.
I'll be there for you. And thank you all.
Thank you so very much, James.
Thank you, and we appreciate it. And thank everyone for watching this morning. And we'll see you this Thursday with a guest to be announced. Thank you so much. We appreciate you.
Thank you.
Thank you.